Financial and social considerations for transplant will cover role of social workers, planning for transplant, Georgia Transplant Foundation and other resources, needs for support, insurance, immunosuppressants and post-transplant medications, planning for potential costs and fundraising, and program requirements. All transplant candidates are assigned a social worker early in the transplant evaluation process. You likely met your transplant social worker when you had your pre-screen evaluation here at the transplant clinic in Atlanta. Or you may have met your social worker during an inpatient evaluation at Piedmont, Atlanta. That person sat down with you and started to get to know you, find out about what kinds of resources might be helpful, and how you might begin to plan for your transplant journey. And that same social worker will continue to follow you throughout your transplant process. As a transplant patient, you'll also meet hospital case managers who are social workers who will support you during any admissions that you have at Piedmont, Atlanta. These social workers will follow you during your hospital stay and help facilitate your discharge plans. These folks will work with the rest of your multidisciplinary transplant team to support you, connect you with resources, and help you prepare for transplant and life after your transplant surgery. How have you started to plan for your transplant? Our hope is that you've gotten started. Once you've had your transplant evaluation, we don't want you to wait for us to tell you to go. We want you to start your preparations because when you're stable and when you're feeling okay, it's much easier to begin your planning process than when you're in a crisis mode or you're feeling sick or you're confused. So what do we expect you to start thinking about? We want you to think about who your support people are going to be, who are going to be the folks who are going to walk down this path with you and learn what you're learning, hear what you're hearing, so that they're with you, and if you get too sick or too confused to lead the efforts yourself, they can step in and support you. We hope that you're thinking about the financial impact that transplant may have on you. You might be working now, or you also could be very sick. We don't know, and transplant is unpredictable. Our hope is that you think about how your disease progression will play out over time, and you think about how your financial situation might be impacted based on your ability or inability to work, and how that will affect your family roles, your financial situation in your household. So think about your supports, think about your financial impact, think about insurance, think about potential medication costs, transportation. All these things need to be considered so that you can be appropriately prepared for your transplant.
Georgia Transplant Foundation is a nonprofit organization providing various programs and services to the transplant population in the state of Georgia. Their financial assistance program may provide Georgia residents with temporary assistance with basic living expenses such as rent, mortgage, or utility bills. They may also provide lodging assistance for those that live far away and need more convenient post-transplant follow-up clinic visits and emergency supplies of medication. Their fundraising program provides Georgia residents with the opportunity to plan ahead for post-transplant medications and other transplant-related expenses. The Jumpstart program may provide assistance with re-entering the workforce post-transplant. They also provide academic scholarships for recipients, their dependents, and parents. They also offer educational programs such as the Trends in Transplant Conference. For more information about these programs and services, please contact your transplant social worker. If you're an out-of-state resident and you need assistance with planning for post-transplant related expenses, please contact your transplant social worker for additional information regarding these programs.
Most transplant candidates rely heavily on their support system. They use their support people to help navigate through the transplant process and help provide care when they're not feeling well, but they also count on these folks to help them at home, to manage their personal business affairs, and to take care of the things that they can't do when they're feeling sick or when they're in the hospital or too confused to pay attention. You have to identify a primary support person. During the transplant evaluation process, you'll be asked to complete a transportation and support plan, and we'll want to know who your primary support person is. That will be our main contact and the main person that you'll rely on to take care of your needs. That person doesn't need to do everything themselves, but they need to be aware of what's going on, and they'll need to tap into other resources, find other people to help provide your care and to manage your tasks, and they'll be the ones to delegate. Unfortunately, your primary support person cannot be a paid caregiver. There is a role for paid caregivers if that's something that works in your situation. However, you will have to have a family member or a friend to manage that paid caregiver because, again, sometimes you'll be too sick or too confused and you won't be able to direct your paid caregiver. Someone besides yourself will need to be able to provide that direction. We have a liver transplant support group that meets twice a month, and that can be a very good resource for you and your support person as you're beginning to plan, and then also as your disease process develops, you await transplant and things change along the spectrum. In addition to the support group meetings, Georgia Transplant Foundation has a mentoring program which can match you up with someone who's been through a similar experience. If you live farther away from Atlanta and you're concerned about travel and lodging from your home that might be more than 50 or 60 miles away, there are some resources available. First, check with your insurance plan. Some plans include a travel and lodging benefit that becomes available when you're listed for transplant or after your transplant surgery. Additionally, if you're a Georgia resident, there might be assistance with travel and lodging through the Georgia Transplant Foundation. Don't forget to plan for your post-transplant visits after your transplant surgery once you're discharged from the hospital. This will be an important time when you're receiving close follow-up with the Mason Transplant Clinic in Atlanta. You'll need to be seen 2 to 3 times a week for clinic visits or for labs, and you'll need to be close by. So if you live farther away, this is when you'll be staying at a hotel with your support person who has a vehicle and can get you back and forth multiple times a week, at least for 4 to 6 weeks. These visits will taper down as you recover, eventually once a month for the rest of your life. It's common to experience some depression and anxiety when you're dealing with chronic health issues and thinking about liver transplant. We encourage you to think about your coping mechanisms and things that have helped you through difficult situations in the past. We also have some resources for you. You're welcome to call your social worker whenever you need a listening ear. We also invite you to come to our liver transplant support group, which meets both in Atlanta and Savannah. And then we encourage you to tap into the resource that Georgia Transplant Foundation has called the Mentor Project. That's an experience where you can be matched with a mentor, someone who has either been through liver transplant or has been a support person for someone who's experienced a liver transplant. Mentors are trained, closely supervised, and they're matched with patients based on location and similar experience. And once you're matched with your mentor, you can use them as a private and confidential resource to talk about things that you're going through, maybe to brainstorm some solutions to something tricky, or to have a listening ear and someone to provide an additional set of support. If you're thinking about hurting yourself or taking your life, please let your providers know. We're here to help, and there are a lot of resources we can connect you with to help you do well. Another part of planning for transplant is thinking about medical decision making. There's a set of documents called an Advance Directive for Healthcare. This includes an introductory statement which tells your providers who you would want as your healthcare agent. This is the person we would turn to if a medical decision needed to be made and you were not capable of making that decision yourself. In the state of Georgia, if you're legally married, our obligation is to go to your legal spouse. However, if you do not have a legal spouse or you prefer that someone else be your decision maker, these advance directives are very important. The first part identifies your healthcare agent. The middle section speaks to your wishes, things that are important to you or not important to you as medical decisions are being made. And the final part is your signature and the signatures of your witnesses. This document is available in the transplant clinic and in the hospital, and your social workers are available to help you with it as needed.
As a transplant patient, it is important that you maintain your insurance. So when planning for this process, you want to think about the stability of your insurance. As your health declines, you want to think about, will you still be able to work? And if you can no longer work, will you be able to keep that insurance through your employer? And if so, will you be able to afford that insurance through your employer? So if you or your spouse are retiring in the very near future and you have insurance through your or your spouse's employer, will you be able to keep your employer insurance during retirement, or will you need to enroll into a Medicare supplement and a Medicare Part D for drug coverage in addition to your traditional Medicare A and B benefit? If you have Medicare and an employer-sponsored insurance plan as part of early retirement, will your insurance combine to convert into a Medicare Advantage plan? If you have Medicare and/or Medicaid due to disability and your qualifying medical disability is liver disease, there is a possibility you will lose that disability, including your insurance, sometime post-transplant after you've recovered. These are just some questions to think about. Of course, everyone's insurance situation is unique. For further assistance, please contact your transplant social worker to discuss any questions you may have pertaining to your insurance situation. And of course, if you have any changes with your insurance, please contact your transplant social worker or your financial coordinator immediately. This may allow for our team to obtain necessary authorizations, allow your transplant social worker to work with you with any financial planning needs that you may have now that you have changes in your insurance, or discuss other insurance options that can be available to you should you lose your insurance. After the transplant, you will be prescribed specialty transplant medications known as immunosuppressants, also known as anti-rejection medications. You will take these medications every day for the rest of your life to prevent your body from rejecting the new organ. These medications can be very expensive, even for patients who have very good insurance. For those patients who have Medicare at the time of transplant, the anti-rejection medications will be processed unconventionally. These medications are covered under your Medicare Part B as in boy at 80%. For those with a Medicare supplement or an employer-sponsored insurance policy, that should pick up the remaining 20%. For those without that secondary coverage, you will be responsible for that 20%. And your transplant social worker is here to help you plan for those medication-related expenses. Your Medicare Part D will not cover the immunosuppressant medications. So here's a list of some of the medications you may be prescribed after the transplant. Please keep in mind that the immunosuppressants may be billed under one part of your insurance, and the other medications may be billed under your Part D or your private insurance pharmacy benefit. There are a few specialty transplant pharmacies that we work with here at Piedmont. Your transplant social worker in the hospital will work with you to prepare for discharge and obtain your initial month's supply of medication. If you wish to continue with one of these specialty pharmacies once you return home, they will deliver the medications to your home. If you want to work with another pharmacy or your local VA pharmacy, please contact them within the first 30 days after your transplant so that they may be able to order the medication to have it available for you when it's time to refill. For those individuals working with the fundraising program through Georgia Transplant Foundation, there are specific pharmacies that work with that program. For additional information on how to use those funds to obtain your medications, please contact your transplant social worker. We want you to be prepared as best as you can for medication and other transplant-related expenses. Some private insurance companies offer a transplant case manager that can help you research your transplant benefits. We provide transplant financial coordinators who can also help you research your transplant benefits. The social workers here are available to help you research your medication expenses, and if you cannot afford any of the medications or other transplant-related expenses, we are available to help you research what resources are available to help you meet that need. Whether you are required to do fundraising or not, Georgia Transplant Foundation has two programs available to help you plan for transplant-related expenses: their Unmatched program and their Matching Funds program. For more specific information regarding these programs and whether or not you qualify for these programs, please contact your transplant social worker. So when thinking about other transplant-related expenses, you also want to think about the non-medical costs, such as childcare. Who's going to watch your pets while you're here in Atlanta? Who's going to help you pay your insurance premiums? Who's going to help you pay for lodging? Think about planning for the cost of transportation to post follow-up visits. And if you're staying in Atlanta because you live far away, how are you going to eat while you're here? Those are additional things you want to think about when creating a budget for post-transplant care. Know your benefits. Private insurance such as Blue Cross Blue Shield, United Healthcare, or Cigna, or many others, their coverage varies. Many private insurance companies have high co-payments for immunosuppressants, but not all do. Check with a transplant specialty pharmacy or call your insurance company to estimate your co-payments for immunosuppressant medications and other expensive post-transplant drugs like Valsite. If you accept the Medicare benefit after your transplant surgery, the immunosuppressants will be covered by your Part D, just as other prescription medications are. Make sure your Part D plan covers the post-transplant medications.
Now that you've attended or watched all of your required liver education classes, what's next? Keep following your transplant team's recommendations. Remember, all liver transplant candidates must remain abstinent from all alcohol and all illegal substances. Complete substance abuse relapse prevention counseling if required of you. Participate in liver education and support group meetings as required. Make plans for transportation, support, and post-transplant lodging if needed. Contact insurance to ask about transplant and medication coverage. Make financial plans for anticipated transplant-related costs. Open a Georgia Transplant Foundation account and start fundraising if required. Consider requesting a mentor. Consider creating an advance directive. Know who your transplant coordinator is and who your transplant social worker is, and keep in touch with us. Remember, we're here for you.